Hello everyone, my name is DANI. I'm the Chief Resident here at the Hawaii Island Family Medicine Residency. On behalf of everybody here in Hilo, we welcome you to our community and to our hospital. Unfortunately, this is the second year in a row that we're not able to conduct in-person interviews and tours due to the ongoing COVID-19 pandemic. So today I'm going to take you around the hospital and show you what it's like to be a resident here. Let's go. So here we are at the main entrance of our hospital. Our sponsoring institution is Hilo Medical Center, which is the largest hospital on the Big Island. As you enter the hospital, on the left-hand side is our primary care clinic, which we'll go to next, and on our right-hand side is the emergency room. Here we are at the entrance of East Hawaii Health Clinic Primary Care. This is the medical home of our residency program and also one of the largest clinics on the Big Island. So this is where you'll see your longitudinal clinic patients as well as most of your outpatient learning in the clinic setting. Let's go inside. So here we are in our clinic. This is the medical home for our residency program. We have 3 different teams in our clinic named after native Hawaiian birds. So each of these teams has an advisor, so that's a faculty member, and there's a PGY 3, 2, and 1, and a mix actually, so there's not necessarily one of each class, but a mix of different residents from different classes on each of these teams. And so patients in our clinic are assigned to one of these panels.
Hi everyone, my name is Dr. Lima. I'm originally from Brazil. I came from Florida. I went to American University of Antigua and I'm so happy to be here. You have no idea. Really enjoy living here in Hawaii. The residency program is amazing. All the faculty, all the residents are so nice. We get along with everyone and I hope to see you soon. Good luck on your interview season.
Here we are in our precepting room. We have Dr. Chang, one of our faculty members, and Dr. THIELEN, a first-year resident here at our program.
Hi, I'm Dr. THIELEN. I moved here from Minnesota, went to the University of Minnesota for medical school. I'm really enjoying my time and love all the opportunities here on the island. I'm big into surfing, so it's always nice to get out there when I have a little bit of free time from rotations. I'm excited that you are considering our program and we hope to see you out here.
Here we are outside of one of our clinic rooms. We have 21 rooms in this clinic for examination, including 1 procedure room. Let's go and take a look inside. So it's a pretty standard exam room that you'll see in a lot of outpatient clinics. The way it works for us in terms of precepting is that we see a patient in a clinic first, and then we go to our attendings, which usually are hanging out in the precepting room. We talk about the patient with our attendings. The attendings come in with us, see the patient with us, and then we have the patients on their way. So that's a tour of our clinic, and right across from our clinic is the emergency room, where we'll be going to next. And here we are in the emergency department. Hilo Medical Center Emergency Department is the second busiest emergency department in the entire state of Hawaii with over 50,000 annual visits. You'll get at least 2 months of ER experience, more if you'd like. One of the really good things about our program is that we are unopposed, so you don't have any other residents to compete with for procedures and those types of things. So you can do pretty much whatever you want, and the ER is a really good place to learn those things. So if you want to do chest tubes, if you want to do intubations, if you want to do central lines, those types of things are definitely available for you. If you want to do more urgent care things like learning laceration repairs and all of that, that's also available to you too. It's more so based on what you want to do and what your skill set is going to be in your future practice as well as your comfort level. So everything's available to you here. Now that you've seen our emergency department, let's go to the 2nd floor of the hospital. So here we are at the 2nd floor of our hospital. Our hospital is relatively small. We only have 3 floors. The 2nd floor is where our inpatient workroom is, as well as our learning center, which I'll take you to in a few minutes. First, let's go to the inpatient room. Here we are in the inpatient workroom. So this is where you'll be spending a lot of your time when you're on the inpatient service. We have a couple of computers, we have a coffee maker, we have tea, a toaster, all the necessities you need while you're on service. We have a pretty robust inpatient service here at our residency program. The way that works for us is that we admit every single one of our clinic patients, as well as every single one of the patients at our sister clinic located across the street, 1285 Wainui. We also admit for 2 community attendings as well.
Hi, my name is Andrew Chang. I'm a 2nd-year resident here at the Hawaii Family Medicine Residency. I'm currently on my Family Medicine Service rotation, which is our main inpatient rotation. It's one of our tougher rotations, but also one of the more rewarding ones. There's a lot to learn, and all of our attendees are very eager to teach us. Thank you for considering our program, and I really hope to see you here soon.
Next, let's go to our intensive care unit. Here we are in our intensive care unit. We have 11 ICU beds here at Hilo Medical Center. This is an open ICU, which means that family medicine residents take care of their own ICU patients when they're on the inpatient service. We also have 2 ICU rotations each 2 weeks. One is in the 1st year of residency and one is in the 2nd year of residency. The ICU was a very critical part of the Hilo community when the COVID surge happened. So there was one surge in August of 2020 and one in August of 2021. During both of those surges, residents learned to take care of COVID patients here and became a very integral part of our training. Here we also have Dr. Hernandez, who's a 2nd year resident on her ICU rotation.
Hi, my name is Laura Hernandez. Currently in my ICU rotation, taught by the amazing Dr. Canas here. He's our ICU doctor. We're learning all about ventilators, about vasoactive drugs, and caring for the acute patient. Thank you for your interest in our program, and I look forward to meeting you soon.
Now let's go to the call rooms. So here we are in one of our call rooms. We have 2 call rooms here for the residents. As an intern, you won't be taking any 24-hour calls and any night float calls. So this is reserved mostly for the 2nd and 3rd year residents here. This is where we kind of hang out and sleep when we can, when we have a busy night float. We also sleep here when we're on our OB calls if necessary. So we can take call from home when we're on OB, but we do have a 24-hour call Monday, Wednesday, and Friday. Next, let's go to the Learning Center. So here we are in our Learning Center, located on the 2nd floor of the hospital. This is where we have our didactics. Our didactics last 4 hours. They're on every Wednesday afternoon from 1 p.m. to 5 p.m. For those that can't attend in person, we also have Zoom didactics. One of the things that I like best about this Learning Center is the incredible view you get outside of the ocean. And today's a very clear day, so let's take a look. And now that we're done with the 2nd floor tour, let's go to the 3rd floor. Here we are in the nursery. This is where the core of your inpatient pediatrics rotation takes place. Hilo Medical Center is actually licensed to take care of any babies 35 weeks or above as long as they don't have any oxygen requirements. Should a baby need to be evacuated to another island, they'll go to Oahu, usually Kapiolani Medical Center. The medevac team takes about 4 to 8 hours to come, so plenty of time to learn about sick babies. So next, let's go to the labor and delivery department. So here we are at the labor and delivery department. This is a relatively busy part of the hospital. We deliver about 100 babies a month here in L&D. When you're on your OB rotation, you'll be taking 24-hour calls Monday, Wednesday, Friday, like I talked about in the call room. And you'll be working with several OB attendings, as well as our family medicine trained OB physician, Dr. FLAIM, who's our program director as well. Here we have Dr. James Finney, one of our 2nd year residents on his OB rotation.
Hi, my name is James Finney. I'm a 2nd year resident here at Hawaii Island Family Medicine Residency. I have a family, wife, and 3 children. And, you know, there was some trepidation about making the move here, but the thing I'll say is that the community here is incredibly supportive and welcoming of physicians. The number of times when I've been out in the community and someone asks what I do and I say, oh, I'm a doctor at Hilo Medical Center, and I swear people look like they're ready to run over and hug me, even with COVID going on. There's so much gratitude from people in the community. There's so much need for doctors here. I've long wanted to work in a place that really needed the care that I could provide, and this is that for sure. If you're wondering what kind of reception you would get here making this massive move, I can just guarantee from my experience that you'll have a very warm welcome, many grateful people, and a chance to have a great adventure while you learn medicine.
Now we'll head on over to the West Wing. So here we are in the West Wing. This building is very close to the hospital, not exactly attached to it. It's where the residency administration offices are, and it's also where our residency workroom is. So we have a foosball table, we have a TV that has Netflix loaded onto it. We also have Dr. Chad AHIA, one of our 2nd year residents here.
Hi, I'm Chad AHIA, and I'm one of the 2nd year residents. I'm originally from Hilo, and I feel very honored and privileged to have been able to come back to my own hometown to be a part of the solution to the physician shortage. I hope that you enjoy the rest of this tour, and I look forward to possibly calling you one of my colleagues.
Next, let's go to the Ohana Cafe, which is the Hilo Medical Center cafeteria. Here we are at the Ohana Cafe, which is the cafeteria at Hilo Medical Center. Residents get 2 meals free here every day. So we have a pretty wide variety of options. Breakfast here is really good. They make really good omelets. They have pancakes. And lunch, there's lunch specials every day. There's also a vegetarian special. There's local food like local mocos, all those types of things. So we have a pretty wide variety of food. So here we are in one of our hospital atriums. This is where we'll conclude the tour. We have a couple of hospital atriums located throughout the campus. It's a nice place to relax, get some sunshine, get a little bit of break from the busyness of residency. Every program has its strengths and weaknesses. One of the biggest strengths at our program is the people, truly. We have the nicest specialists that are always willing to help us out. We have the nicest faculty members. We have such a positive learning environment here. Nobody makes you feel stupid. Nobody makes you feel inadequate for not knowing things. It's very much a culture of let's learn together and let's grow together. And you get to train in a rural island environment. Thank you again for watching this walkthrough of our residency program and our hospital. Again, my name is DANI. I'm the chief resident here at the Hawaii Island Family Medicine Residency, and I look forward to seeing you soon. Thank you.
Hello, my name is ALLISON FLAIM. I'm the program director here at Hawaii Island Family Medicine Residency. We're so excited that you guys are interested in our program. Just wanted to give you a little bit of some background about me and why I came here. My training is in rural family practice. I completed a one-year rural family medicine fellowship and still have been practicing full-scope family medicine with high-risk OB, including C-sections. That's part of the vision that I hope to bring here to this program and to this community. The bigger vision for our residency program is to get well-trained residents in the Pacific Islands and specifically tropical rural medicine that this community has to offer here at Hilo. There is no shortage of pathology in this community, and I also think that our community of patients is a very unique group. They've been through a lot over the years. They've been through dengue outbreaks, they've been through tsunamis, earthquakes, volcanoes, and now a COVID-19 pandemic. One of the things I've noticed about this community, including the physicians and the people that live here, is that they all tend to check on their neighbors, make sure everybody's doing okay. And I've seen that in our residents as well. So we're so excited for you guys to be able to take our virtual tour today and looking forward to meeting you guys on interview day. Thank you.